Hi, my name is Maddie and I am recording my review final video for the semester. So, as far as my goals at the beginning of the semester were to become proficient in creating APA citations in all assignments that I submitted. I was going to be utilizing both the checklist that was created by the professor and also Purdue's website and resources. I feel as though I completed that goal successfully. The Purdue's website, especially, is a really great resource. And then after completing the citation, being able to go in, look over everything with the checklist, and just ensure that everything looks correct and appropriate according to the guidelines that were set apart for APA 7. So I feel as though that goal was accomplished by myself this semester. The second goal was identifying good versus bad articles. And this was a little bit more of a struggle for me, I think, just with being able to identify when it was like specifically a study that had been done and they were just like commenting versus and showing statistics and things of that nature versus a full on study during the assignment. That was some of the feedback that I received by you. Two key learnings for me. I would say the Pico learning question like fully changed how I'm able to research. And then also the second key learning was the search strategy that the PowerPoint that you showed for how to do the advanced search on the library websites with both the two websites that you used. They definitely go hand in hand, but the Pico question, being able to sit down, gather my thoughts, what's my goal for the information that I'm trying to find, what patient population am I looking for, what comparison am I trying to create and find information for, what outcome am I looking for, and then what's the comparison that I'm making to. So the patient population that I want to use, and then what's the patient population that I'm comparing things to. Really, really, really helpful to be able to use those keywords in the advanced search, the and or functions, all those kinds of things, with narrowing things down and also being able to narrow down like year and full article versus not full article. So definitely two major things. I have not really been shown how to research in an upper learning setting prior in my LPN program. We didn't really do any research papers, research like presentations. It was a lot more of absorbing a lot of information, and testing is like how most of our professors and instructors taught. So definitely seeing like a shift in practice with being able to really engage with research and evidence-based practice in a more full way where I can really function and find my own research a little bit better, and understanding how to do that was really lovely with this course. The two project reportings that I reviewed, one was by Morgan Lakey. She did hers on medication errors and specifically on the prevention of it through barcode scanners in the OR. And she noted that the changing of empty syringes, so like if a syringe runs out, that's typically where most of the different medication errors were occurring, according to the study that she had found. And I felt as though she presented really clearly, really well. Her evidence was very, very clearly laid out. The implementation strategies, I really enjoyed the idea of a simulation. I feel like most nurses, myself included, that I've interacted with, tend to be more like physical, hands on learners. I think that a lot of nurses can be very tactile, which I think makes sense for our profession. But I like the idea of being able to actually like physically practice things rather than just a reminder of like, hey, we do this thing, but actually being able to say like, okay, this is how you do it from point A to point B, and being able to do a simulation, whether that's online or in person or what have you. I really like that idea of an implementation strategy, and I thought it was unique compared to some of maybe the education that I've received when working in, hey, we're doing this new thing. A lot of times it's just told verbally or written out rather than actually being able to engage with in a more personal way. So I liked that. The only thing that I really would have done different is when she was going through her clinical background presentation, I would have included like, this comes from this person, this comes from this person, and where it was coming from in her references. But I feel as though her project was really strong. It was engaging, references were solid, all of those things. The second project that I listened to and that I'm reviewing was Preventing Falls by Misty Maston. She was very, very evidently passionate about the subject, which I think was just really special and cool for her to be able to engage in um, topic that she's intrigued by. She mentioned in her experience as a long term care nurse just how she's seen how devastating it can be. So I think just being able to bring not only the evidence based research that she's done, but then also personal interaction with the topic was really special for her to be able to do. And for her to be able to really engage with like the practices that have worked well. And she had probably a better understanding of the practices just because obviously falls are something we all interact with. We've all interacted with fall prevention, but she was very, very clear in like all of her explanation and concern for different things, which I thought was cool. The implementation strategies, I like the idea of reassessing fall risk throughout patient hospitalization or long term care stay or what have you, whatever type of admission it is, and to whatever type of clinic it is, whether it's long term care, outpatient, what have you. But just being aware of that and reassessing, I think, was really cool. Um, I think her conclusion was super strong. She really tied it all together in a nice bow, I feel like, and explained things very well. And then also just like really reinforced how important it is to stay like keeping up to date. I think a lot of times, um, with all of the things that nurses carry, we can not always be thinking about keeping up to date just because our task list can go 3,000 miles long. So her really just emphasizing, are there better resources out there? Are there better practices out there? Is there a better bed alarm? Just asking those kinds of questions was cool just to see her engaging with that, especially hearing that she works in long-term care and knowing often what the staffing ratios look like in those settings. The only thing that I would have done different is at the beginning of the presentation, I was just having a hard time following where exactly it was that she was talking. So just identifying, my clinical background and then explaining it, and then also naming any references that she had from her clinical background. Otherwise, I think that her project was like super solid. And once again, I really, really enjoyed how passionate she was about it. And then for me, how I plan on implementing evidence-based practice and research in the future. Some of it is continued. I've researched different things, definitely not to the extent that we were able to really engage with it, and being able to like trace a thread for one project the whole time was really cool. But I think continuing to try to educate myself, and especially really trying to stay in the vein of the field that I'm in. The reason that I chose the chronic pain stuff is I work with substance use disorder, and chronic pain very evidently plays such like a large part in a lot of their lives. And then also I think sometimes what can be hard for substance use disorder, sometimes they can be labeled as pain seeking or drug seeking due to pain or what have you. So being able to engage with chronic pain more deeply, I think was really cool. And then also being able to engage with something that's going to affect my patients was really, really special. So I plan to just continue my research on chronic pain and the management of it, especially, and then also just being able to use pico questions. So as I work in a fairly small clinic, so being able to implement change is actually very feasible, which is really special, and like a systemic level, not just in an individual nurse level. So if I'm noticing maybe our patient population has a specific need, utilizing that PICO question to try to find better evidence-based practice research, and then moving forward with that, and bringing it to our medical director and our providers that we work with. My specific job currently, I'm like an intake specialist nurse who also is like a care coordinator kind of idea. So this actually will be like a very beneficial thing for me to be able to really engage with. And we are consistently talking about updating our practices for fentanyl use disorder and things of that nature. So I feel like this class came at a very, very unique and special time in my career, while I'm in a space where I'm able to really like do a lot of care coordination and utilize a lot of that, if that makes any sort of sense. But yeah, I did enjoy this course, and it was actually very, very beneficial to be able to really, really learn how to engage with like the best way to research, and it like fully clicked for me um, of how to utilize that. So that is the conclusion of my video. Thank you so very much for all of your time this semester and just the ways that you taught the course.